Right. So if you have read and understood, considering it communication skills station, kindly begin.
Hi, my name is Shoaib. I'm one of the surgical doctors here. Can I ask confirm your name and age, please?
I'm Ron. I'm 32 years old.
All right. So here on behalf of Mr. Mann, unfortunately, I have a bad news for you that we have to cancel your procedure. I'm sorry for that.
Oh, this is so bad, doctor. I've been suffering so much for this. And this injury to my knee, it's very, very, very painful. I have so much of pain because of this. I'm not able to go to work. And this is not done.
I really apologize for that. I know it is difficult for you. I understand that. But unfortunately, Mr. Mann is busy because of some emergency procedure. And yeah, and that's why I have to come on his behalf. And I'm here. Are you fasting for the procedure?
Yes, doctor. I'm fasting since last night. And this is
Oh, I'm so sorry. I'm so sorry. Should I offer you some foods and then we can continue our conversation? Is that okay?
Okay, yes, sure. But I would like to know why is this happening? Because this is second or third time and all my family is suffering due to this.
I know you are in difficult situation and I totally agree that it should not have been happened. But unfortunately, Mr. Mann is the consultant who is supposed to do this procedure, and he is busy in some emergency operation. So that's why we have to do this. I do apologize. And can you tell me how otherwise we can help you so that it won't happen again?
Is there anyone else who can perform my surgery, who can perform this procedure for me?
Unfortunately, there is no one today, but if you want to change your consultant, and I won't advise you, but you can change your consultant because of repetitive cancellation. But still, I would say Mr. Mann knows all the rest of the details. So it would be better if you go with him, but it's totally your choice. If you want to change, but they will start all the process again. So it's totally your choice.
Okay,
but I would suggest, yeah.
But doctor, why my pain is? I am having so much of pain. I should have been done first before the other patient. Why he's gone to see other patient?
I'm so sorry. I'm so sorry for the pain. And should I give you some analgesia? And then we can continue our conversation. I apologize.
Yes, doctor.
Yeah.
No, that I'm already on.
Give you some analgesia. Yeah, please.
Yes,
sorry,
doctor. So can you at least give me the next like tomorrow's date for the same procedure, so that I don't have to undergo the pain of documentation and getting admitted again and so taking leave from work?
I really apologize for that. I don't have authority to do this. What I can do for you is I can go to my consultant. I will talk to him. You can have my number. I will leave it with the nurse. And as soon as I will get a plan, I will contact you myself and will let you know when earliest it is possible for us. Is that okay?
Okay, doctor. But please promise me that I'll get this date. The date. Can you promise me this date?
Well, I can't unfortunately promise a particular date. What I can do is I will talk to my consultant. I will convey all your concerns and worries, and I will ask him to get it at earliest day. This is what I can do, and of course I appreciate that you are in trouble. So probably this is what I can do on my behalf, but I can't actually pinpoint anything, unfortunately, because I don't have that authority. Is there anything else at work or home which I can help with?
Yes, doctor, because due to nature of my work, it's not possible for me to take a vacation or to take leave uh, so frequently. So can you please help me for that?
Yeah, definitely. I will actually talk to my consultant, and I will obviously give you a letter which will, help you to adjust your work, and will give you leave on that behalf, because we obviously we understand that you have a knee injury, and we also can talk to your GP to help you with that, and anything else at home which we can help with. Are you living alone, or do you have anyone else which can help you at home?
Yes, I'm living with my family, but can you give me some certificate for to take the rest from my work, like
Well,
a bed rest or something?
obviously, I will talk to my consultant, and he
Okay.
is actually the authority, but he will. I will talk to him, and he will issue the certificate for the rest or change in the duty, or I will talk to your GP as well if he can do it.
Okay, doctor.
Anything else which you want to?
Okay, doctor. And please, you will also be writing certain medications and what exercises should I be doing?
Yeah. So for this particular thing, we will request you to continue the physiotherapy which we already advised, and for the pain relief, we are not changing any medication if the pain is under control.
Okay, doctor. Okay.
Yeah. Any more questions?
No,
change. In this one, patient is taking diclofenac, and you will add antacid.
Okay, sorry, I don't know. So let me summarize it for you. So so you came here for your arthroscopy for the third time, which is unfortunately canceled because Mr. Mann is busy in emergency because of a trauma patient. And what we decided is that I will give you my number, and I will take your details, and I will talk to my consultant, and will get the date at earliest, and I will call you back as soon as I get the dates and the details. And I have changed your medication, and I will arrange your letter for the work, and I will arrange necessary social support if needed. So anything else, any questions or anything?
Yes, patient wants to do the complaint, so you'll give the POPS form.
Yeah. So yeah.
So you can say, okay, this is your right. I'll give you the form, and you can fill it in and give it to the desk. Yeah.
Okay.
Registration desk. Okay, very good. I think that you can do that very well. So, Dr. Snell, would you give the feedback first, please?
Yes, ma'am. So sorry. I just wanted to know that if we say, ma'am, why is my procedure more important, not important than other person?
You can say that. And in this scenario, patient will be very angry and aggressive and frustrated. And yes, here examinee will explain why others, because emergency RT arrival came. So that's why consultant had to give them more priority, because that was life-threatening situation for them.
Yes.
And here, one more thing, when you ask for another doctor and he was telling you that this will be time consuming, etc., then you should have said, okay, you do it for me.
Oh, okay.
Yeah, this one question. Yeah.
She was very kind to me.
Yes, she is soft in nature, but then exam actor will not be polite and soft. Dr. Abbas has raised hand. Yes, please.
I just noticed he he made an interesting question initially, asked the patient if the patient was fasting.
Very
and
good.
if he wants
Yes.
food offered to
Yes.
him.
Yes.
And that's quite interesting, and I think it may earn some marks under
This
extra
one.
marks
Yes,
under the communication
definitely.
skills, because it's not a regular component of
No.
yeah,
That's
that
how you
people usually
learn.
ask.
Yes,
Yes,
exactly. I wanted, maybe Dr. Snell didn't pick it, but I wanted her to point it out. Very good. This is like he would definitely get extra point for this
Yes.
conversation, and how he was trying to calm the patient down. Patient was very soft and polite. That's another
Yes,
issue. Yes,
Yes,
very good. Yes.
yes, ma'am. So
Anyone else? Yes.
that's all, ma'am. Thank you.
Yes. Thank you. Dr.
Thank you,
Snell,
ma'am.
would you want to add anything else?
No, ma'am, that's all. This was just my first time.
Yeah, that was your first time. Thank you so much. Okay,
Thank you.
physiotherapy, you made him ask, you made him tell you that he, because that was very good about the exercises. And then, all right, painkiller.
Yes, ma'am, painkiller.
Yes, I told him. And then Enta said he has to add because it was causing heartburn. And at the end, you'll give the pulse because patient is so angry that patient will definitely want to complain. All this. So, yes, very good. And he was empathetic. He was apologizing and right, nice.
Thank you. Thank you very much.
Thank you, everyone.
Thank you.
Started your timer and here is your question.